Hi, I'm Dr. Norgard. What brings you in today?
My wife thinks I have selective hearing.
He doesn't understand anything I say, or he tunes me out. And when we watch TV, it is so loud.
I think I hear most everything. I have noticed everyone else mumbles or talks too fast, especially women and grandkids. I do not like going out to restaurants anymore. I would rather stay home because I don't catch what is all being said.
Why don't we get started with a hearing test and see what kind of results we get? Hearing loss is the third most prevalent chronic health condition facing older adults. On average, hearing aid users wait over 10 years after their initial diagnosis to be fit with their first set of hearing aids. There is a strong link between degree of hearing loss and risk of developing dementia. One of the first signs of hearing loss is often an inability to hear and understand speech in noisy environments. Ringing or buzzing in the ears is also an early sign of hearing loss.
You can thank the invention of the earbud and noise-canceling headphones for the fact that more young people are listening to loud music for longer periods than ever before. And as a result, it's estimated that 38 million Americans experience some form of hearing loss. Only loud music isn't the only cause of hearing loss as we age. And as Dr. Mandy Roundsville-Norgard with Sioux Falls Audiology Associates is here to tell us, when it comes to hearing what you don't know, or in this case, hear can hurt you. Welcome, Mandy.
Thanks.
So what are some things that we experience every day that is affecting our hearing that we would not even imagine?
Just being exposed to everyday environmental noises, just from construction noise around Sioux Falls to mowing your yard now that it's spring. A couple weeks ago we had snow, so people were using their snow blowers. Those kind of things can affect our hearing as well as our overall health.
And what is the most common type of hearing loss?
The most common type is sensory neural, which means nerve damage. So those inner hair cells in your inner ear get damaged, mainly from noise and aging. And then once those get damaged, you can't really recover that.
Okay, so what are some signs that we are experiencing hearing loss?
So some signs of hearing loss, I think the biggest one is difficulties hearing in background noise. The next one I would say would be ringing or buzzing in the ears. And then you find yourself straining, or even at the end of the day, you're just kind of exhausted from trying to hear what people are saying. Television, a lot of people say the television isn't as clear as it used to be, and then you're asking people to repeat themselves.
And turning that volume up even higher.
Yep. Yep. And then you might feel like other people are mumbling. You might ask others to repeat the conversation or reword it. Missing phone calls or the doorbell, or you find yourself maybe naturally reading lips.
Instead of actually listening to the words. All right, we have some more here.
Yep. Sometimes people don't notice how loud rain is anymore, or they may not notice the blinker in the car. The leaves in the fall maybe not as intense, or the dogs, or just loud noises aren't as loud as they used to be, like dogs barking. Or you find yourself avoiding social events because you realize it's more exhausting trying to hear in that background noise, or you just get frustrated and you just avoid it altogether. And then of course the ringing, the buzzing, the humming in the ears, one ear or both ears. But one thing that I do want to bring up is if you notice a sudden change in one ear, buzzing or ringing in one ear, vertigo or pain, that is a medical emergency, and you do want to get in. You don't want to ignore those signs.
Okay, so get in right away. But looking at all of these different signs, why do you think people don't get in right away when they're starting to experience these?
Because hearing loss, age-related, noise-related hearing loss is so gradual, you almost learn to adapt to it. So you just think, I'll deal with it later when it becomes more of a problem. Or a lot of people think it's an ailment of age, and there's so many different causes of hearing loss that age is, that shouldn't even be a factor why somebody shouldn't come in. So for me, I lost my hearing as a child from medications, and so I guess I don't think of it as an ailment of age. I look at it as you're taking care of your body, you're taking care of your health.
So when you have a child who's maybe experiencing hearing loss, they might not know. They might just think that that's normal. So how can you kind of stay on track and check your kids and get them in to make sure that they are hearing?
Yeah, I get a lot of parents that think, they don't hear anything I say. You know, I have a 3-year-old and a 4-year-old. Their minds are elsewhere. They're watching TV. They're watching the tablet. You say 20 times, get your shoes on. So a lot of the schools are pretty on top of things, getting a baseline hearing test. But if parents are really noticing something, maybe they're doing a task and you're saying their name from behind. That was my mom's first clue. And they're not responding, then it would be a good idea just to double check, get a baseline. And if the teachers are kind of bringing that to your attention as well.
Okay, what does that baseline screening look like?
So when you come in for a baseline, we get a good history of your noise exposure, just your health history. We look in the ears, make sure, number one, that it's just not wax, and then we do a beep test where we just kind of skim through a bunch of frequencies and we just make sure that the hearing's doing okay.
What are some things we can do to prevent hearing loss?
The biggest thing is wear hearing protection. So even if you're mowing the yard or operating a snowblower, wear hearing protection. It doesn't take much to start that damage. And the other biggie is, I know a lot of people wear earbuds while they're mowing the yard and doing some of those yard activities, and they're cranking up the music to overpower the noise that they're operating from that machine, and that can even cause more hearing loss. And even if you have a hearing loss already and it doesn't sound loud enough to you, you're still causing hearing loss. So even for me, I have to be mindful of still wearing hearing protection.
So what exactly do you mean by hearing protection? Is this just earplugs? Do we need a headset? What are the best things to use?
There's all kinds of hearing protections you can use. You can do the foam plugs. If you get those in, you just got to know how deep to get those in, because those are going to attenuate the best. Otherwise, you can go to Shields, get the muffs. As long as they're not slipping and sliding, you should be fine. Otherwise, you can get custom molded earplugs. So we offer that at my clinic too. We can make a mold and then they're custom made and they are not going to come out.
And you mentioned hunters, but we do have a lot of hunters here in South Dakota. So what type of hearing protection should they be wearing? Because we think, oh, we only use, shoot the gun a few times a year. This can't affect me. But it's very loud. So what's the best thing to use? So
a lot of hunters won't wear earplugs because they want to be able to have a conversation while they're for safety and all that stuff. There are options out there where you can get a pair of electronic earplugs where you can still have the conversations for safety, but when the gun goes off, it attenuates that noise to a safe level. So there are options. So to somebody that says, I don't want to wear them because I want to have a conversation, well, there are options.
And if you suffer from hearing loss, can you come back from this, or do you have it the rest of your life?
If it's accumulated over time, the hearing loss has been gradual, chances are it's not coming back. If you suffer an acoustic trauma where a loud blast happened to go off, and you could potentially bring some of that back if you respond immediately, getting into an ear, nose, and throat doctor just to get on top of it right away.
And then you have an event coming up called the Lunch and Listen. Why should people attend this? What are they going to learn?
They're going to learn a lot more about hearing loss and hearing loss prevention. And it's just a nice way for people that have been curious. They can just come, they can have lunch on us, and we'll talk about it. And we can also learn about hearing aid technology. So if you're on the fence, you just are curious, it's just an informative, casual way to just get the information. And then we can even take it a step further. If you already wear hearing aids and you are curious about what new technology sounds like, we'll have some hearing aids available that we can program and you can experience that. And for the month of May, we are offering $1,000 off a pair of premium hearing aids to celebrate May is Better Speech and Hearing Month.
All right. Thank you so much, Mandy, for coming in and sharing this information with us. Sioux Falls Audiology Associates offers free hearing screenings. All you need to do is call them at 605-306-3050 to schedule your free screening today. You can also find more information about hearing loss on their website at drmandysf.com.